Hi, in this video I'd like to talk about urinary tract issues where basically you're having trouble peeing and it can progressively get worse to the point where you can't go at all, which is called retention. And what I'd like to do is explain what happens in those situations where it progressively gets worse. So probably you've had trouble sleeping at night and you've been getting up multiple times. You have urgency, you can't empty your bladder completely, get back into bed, and then before you know it, 10 minutes later you're in the toilet again, and it's not a pleasant experience. So I've been experiencing this for 5 years. I've managed it, but it's progressively got to the stage now where I'm wearing a permanent catheter waiting for surgery. In my case, I've got surgery tomorrow, yay, after 5 years. And I'll be having a TURP procedure. I'll hold that video for another, I'll hold that information for another video because talking about surgery is quite a subject in itself. But in this video, I'd like to explain to everyone how to live with catheters and what to expect, what to do when things go wrong, what sort of test procedures the doctors will ask you to do, and how to manage it yourself, because let's face it, doctors and nurses are very busy and you might be sent home with a catheter in place and with just the minimal amount of information. So I'd like to, from my own personal experience, I thought I knew enough and I didn't, and so I'd like to close those gaps in this video, talking about how to live with these and getting through the day with the minimal amount of pain and avoiding things like UTIs, infections, and how to clean yourself and things like that. So yeah, it's a lot of information to convey, but it's important. You may not experience everything that I have. You may get through without much pain and may only have a catheter for a few days and go back to the hospital and have it removed. Or you may run into the problems that I have. So let's start off with the catheterization. So you've had trouble. Let's say that you've had surgery and maybe you've been given opioids, or you've got an enlarged prostate like I have. So one way or another, it's restricted, you've got inflammation, and you're just having trouble peeing. So you know, because you can't go to the toilet and maybe you're straining and straining and just a few drops are coming out and you can feel that you're getting extended. You're starting to build up urine in your bladder and you just can't get it out. Now, typically speaking, most people, when they go to the toilet, will probably pass 200 to 250 milliliters, so around about a cup. Now, when you're going into retention, what will happen is you'll pass less and less urine as you're straining to get it out. So in my case, I was lucky if I got 50 out. So I've got to pee. Well, I had to pee probably 4 times more often to get 1 cup out, and it would get worse at night. So when you're in retention, what happens is it's building up, and there's a limit to how much your bladder can hold. So when you get to 750 mil, you're crossing the point where you can start damaging your bladder, and you need to go to emergency, tell them that you're in retention and you need a catheter. I experienced this 4 times in my life and it's not a pleasant exercise, but the catheter will give you instant relief. You might have pain when it's going in my case all the time, but the relief that catheter gives you is just, you wouldn't believe it. You really need that catheter. So yeah, so when you're in retention, what will happen is you'll feel like you're absolutely full and it'll come in waves. You'll go to the toilet, you'll try and go, and nothing will come out, and then it'll subside. And then maybe 15 minutes later or 20 minutes later, it'll come again. So it comes in waves. In my case, I'd go to the emergency, and depending on the emergency, like one time I had to wait 10 hours in emergency before I could get a catheter, and that was not pleasant at all. And by the time they put the catheter in, they removed 1.2 liters, which is way over what you should be having in your bladder. So when they put the catheter in, just before they put the catheter in, they'll do a ultrasound to see how your bladder is doing and how much you're retaining. So the last one I had, which was yesterday, because I went in retention, I had a catheter in, but it got blocked. I had 780, which is not too bad, but I've had 1,400 mils backed up, and that's not good, because your bladder stretches when you have that much urine left inside you, and it's just like a pair of underpants. You've got elastic there, you can stretch it and it'll come back into shape. But if you stretch your bladder by retaining too much fluid, there'll come a point where you'll stretch your muscles and they won't go back. That doesn't happen often. In my case, even though I had retention, it always seemed to come back, and lucky, touch wood, I'm still being fine. So that's what they're looking for, is how much you've retained, and so they can know if your bladder's been stretched. So what happens is they put the catheter in. So this is an intermittent catheter, or self-catheterization catheter. See, there's only one end point. If you go to hospital, they'll give you something like this, which is a foley catheter. Notice how there's two end points on this catheter. So this is the drain, and this is the port for which they'll inject saline like this with a syringe. So they'll put much bigger than this. They'll put a syringe in there and inject that with saline, and at this end, that's the end that goes in you, there'll be a little balloon here that fills up, and that's what's going to anchor the catheter inside you. So you go in, they lay you down on a bed, they disinfect everything, they clean up everything, and then they will get a pan under you, because when they put the catheter in, there's going to be urine coming out. And just imagine that this is your urinary tract. Just before they put the catheter in, they'll usually put some numbing agent into the end of your penis or vagina, and they'll inject that in just to numb it a little bit, because it is going to sting. And if you've got a large prostate that's angry like mine is, it's going to hurt. But generally, the first part, they'll just inject it like that. In my case, I've got a large prostate. Imagine that's your prostate. That's all a lot bigger than this in my case. So there's a bit of restriction there. So they'll put it in, and then in my case, they'll hit the prostate, and there'll be a bit of resistance. And if they can't push it through, they'll ask you to cough, and that just sort of like relaxes the muscles, for instance, so they can get it through. And whoops, so there you can see I've got all the way through, and then that's when they fill this end with saline. The balloon appears here, and that anchors it inside the bladder. And what they'll do is they'll push the catheter, and it'll go all the way into your bladder. They'll inflate the balloon, and then they'll pull the catheter back like this, so that the balloon is then at the base of the bladder, so it's nice and anchored in. And as they're doing that, all the urine's coming out of this port here, and being drained out. And you'll get relief. Relief like you've never known before. It is so, after being like a day or so in extreme distress, this will be a godsend. So now they've got the urine out, what they'll do then is they'll strap this to your leg. So there's lots of different types of straps. I like this type here, which is like a little pivoting access point. So that hooks into this part here. And that stops this jiggling around, because when you've got movement and you can see this is moving around, you're going to have discomfort at this point here. So anchoring these so that it doesn't move as much is a good idea. Now once they've anchored that, then they'll put a bag on you. And there's two types of bags. One is called a day bag, which is like this. So this one's 600 ml. This is one of my old ones. It's faded a bit because I bleach it in bleaching water to keep it clean when I change it out. So this is the day bag, and it's got these straps. So this is at the top end. That goes into the catheter. So it would be like this. Goes like that. And then this is the end that points down, and you've got a little open and show close valve here, and so that's open at the moment and that's closed. So there are different types of bags that you can have. So here's another one. This one I got in London, and it's got a different type of valve, so you can open and close to empty the bag when it fills up. So you think, well, 600 ml should last you a day. No, you may have to empty this 3 times during the day. And as night comes on, you don't want to be getting up emptying a bag in the middle of the night. So hopefully they will give you a night bag as well. And you can see that this has a longer length. So the idea is you take off your day bag, pull it out, and then you plug in the night bag, and this bag can sit at the bottom of your bed. Note that it's got to be lower, so that because it's gravity drained. If you put it on the bed with you, it won't drain as well, so keep it lower than your leg so that it drains well. All right, so what I've just told you is that you've gone to emergency, they've given you a catheter, and they've put it in after, and they've put the day bag on your leg. The next thing that will happen is they'll start doing blood tests and a urine test. Now the reason why they do blood tests is because they're worried about your kidneys. When you back up and you're not emptying your bladder, you can get infections, and bacteria can grow in your bladder because it's used to almost voiding completely, but because you're retaining urine, you can get infections, and those infections can go up into your kidneys, and the kidneys have lots of fine filters, and if that happens, your kidneys will gradually degrade over time. So one of those blood tests will determine if you've got kidney issues, and they'll do things like blood count and other things just to see if your bloods are okay. But they also do a urine test, and the urine test is to determine if you've got bacteria as well. And then if you have, well, you're going to start needing things like antibiotics. So here we go, antibiotics. So, oops. Antibiotics, and there are lots of different types of antibiotics that you may have to start taking. And generally at the start they don't know what type of infection you have, and the hospital may just send you home without antibiotics at all because they want you to go to the GP and find out about that later. But yeah, so if you get sent home with the bag, what could happen is that you don't know that you've got to take the bag off and put the night bag on. Maybe you do, maybe you don't. But during that process, you've got to keep things very clean, because this part here, you're touching that, and if you haven't washed your hands with soap and you're touching that, bacteria can get in. And even when you are clean, you've still got a chance of getting a UTI. And when that happens, you'll be in a world of pain. The feeling is, the best way I can describe it is, just imagine you've got a carpet burn. You know, where you scrape yourself on the carpet and it's all red raw. Well, just imagine that someone started cleaning that with vinegar and a toothbrush. It's going to burn and sting. So with UTIs, they're going to gradually progress to the point where you'll be in agony, and antibiotics will deal with that. It'll probably take 1 to 2 days. Probably by the 3rd day, the antibiotics will have it under control. So I'll talk more about cleaning in a moment. I'll just stick with antibiotics. So with the antibiotics, generally what the doctor will do is give you a broad spectrum antibiotic, hoping that that will deal with whatever bacteria type that you've got at the time. So they'll give you a broad spectrum one, and maybe it'll work, maybe not so much. So if you still have trouble, what you need to do is go to your GP and ask for another urine test where they identify the type of bacteria that you have. So they have a petri dish. The people that do the testing do this. They have a petri dish and they have all the different types of bacteria, and they grow out the E. coli or the bacteria that you've got, and they work out which antibiotic is going to work for you. So if you're taking antibiotics and you're not getting relief, do that test, and then they can give you a antibiotic that deals with the type of bacteria that you've got. Now, my experience with this is each antibiotic is different, and I've had lots of different types. Thought I'm fine, and then the UTIs come back. But yeah, some of them could be pretty rough on you. So the last one I had, it destroyed my digestion. I had a sore tummy. Well, it felt like it was burning. I had violent diarrhea, and even though I had a catheter in, it blocked up my catheter, and I had things like diarrhea and constipation even affect catheters. And I tried to clear the catheter myself, and the way you do that, which you normally don't do yourself, you go to emergency and they try and clear the catheter. But this port here, where you empty, you would fill a syringe, probably bigger than this, with distilled water, boiled water, and you would put in that water, trying to clear any particulates that are stuck into that along that tube. So let's say these little holes at the end here, they've got something stuck in them, so you could flush it out that way. So in my case, it got blocked. I tried to clear it myself, couldn't do it, didn't work. The hospital tried the same and said no, it's blocked up. So they took it out. There was blood, there was pain, and then they put in another catheter. All right, let's collect our thoughts. So I've talked about antibiotics and what to do about UTIs. What I haven't spoken about is how do you keep things clean. So if you get sent home with a catheter, and it's generally what they'll do is they'll send you home for a week and ask you to come back in and do a void trial. because they want to know, is your bladder, if it was stretched, has it come back down, has it shrunk back down, and can you empty the bladder on your own without a catheter? So they'll send you home for a week, and then they'll ask you to come back in, and then they'll do the void trial. So what happens then is they take the catheter out, and you go, whoa, I've got the catheter out, I can move freely now without worrying about hurting myself. And then they'll get you to drink a lot of water, so let's say just over 1 litre, and generally they ask you to start drinking before you take the catheter out. And what's going to happen is they'll ask you to drink as much as possible, like just over 1 litre, and then at some point you're going to have to go to the toilet, and they want you to measure how much you passed. So hopefully, if things are normal, you'll pass almost as much as what you drank. But as an example, in my case, the last one I had, I didn't pass nowhere near 1 litre. I barely passed 150 ml. So you can imagine how much is still left inside the bladder. And when you do pass it, they want to know immediately, so that they can do an ultrasound and see how much is left behind. So yeah, I went to the toilet. I knew straight away I wasn't passing enough, and I asked, can I try a little bit longer? And they said, sure, just relax. You can take an hour, try and pass as much as you like. But at some point, we're going to have to call it a day. So at the end, I think I only got out about 200 ml, and there was something like 400 left inside me. I failed the test. What they want to see is, in this case, they said 150 ml was the pass rate. So if I got it down to 150 ml, I could go home without a catheter. But because I had so much, they said, I'm sorry, we're going to have to put a catheter in again. And so it went back in, and I was very disappointed, as most people would be, because you think, oh wow, I'm going to have my life back. I can move around, I can go shopping without doing this funny walk. Yeah, so I put it back in, and then it's 2.5 weeks or 3 weeks later, they'll get you to come back in. So they're very worried about that bladder. Maybe your bladder hasn't shrunk down enough yet for you to really push out all the urine. In my case, it's a large prostrate. So the prostrate would normally be something like this size, but it can grow to something like the size of a tennis ball. And as it does that, it puts pressure on the pipe, and it just restricts the flow. So yeah, you're trying to pee, and over time you're getting less and less flow going through. Right, I'm sorry I'm going all over the place. There's just so many things to remember. So 3 weeks with a foley catheter in again, and you're sent home hopefully with a day bag and a night bag. If they do try to send you home without a night bag, just mention it, because you need it. You want to be taking off that day bag and swapping out for a night bag at night. And if you can, get some extra straps, so things like this and this, because you need to be strapping those bags to your leg so that they don't move. So what I found was that if you didn't strap them properly, the bags will start, or the day bag would fill up, and it would start getting heavy, and it'll slip down your leg. And what happens is, as it slips down your leg, it starts pulling on the catheter, and that's not a good thing. You don't want tugging and pulling on the catheter like this, because you can do yourself an injury. There is the bubble balloon at the other end anchoring it into your bladder, but you don't want to be tugging on that. So these straps are really important, and I'd be constantly, if I go shopping, I'd be, oh, it's slipping down, I'd be adjusting them. So I would even do straps on the straps to anchor it to my belt so that it wouldn't slip down. So where were we? 2 weeks, 3 weeks, and then you go back in and you do another void trial. In my case, I kept on, still wasn't good results, and I thought, oh, I'm so desperate, I don't want to go home with the catheter. So I asked for more time, and eventually I got it down to about 200 ml in my bladder. And the nurse said, okay, you can go home without a catheter, but you're going to have to intermittent catheterization yourself if you have trouble. So, because they don't want to send you home and you're going to be backed up that night. And I'd already researched this myself about how to self-catheterize. So notice that the self-catheterizing catheters are different. They've only got one end point at the other end, and there is no anchoring balloon. So here's one I've taken out. So it's very simple, and the idea with them is that you're having trouble, you know you're backed up, you can put this in yourself, deal with the problem, and then you pull it out and throw it away. It's oversimplification of the process, but let's go into a little bit more detail. So there's two types of catheters that you can put in yourself. So this one here has no lubricant on it. And where's the other one? This one here is a self-lubricating catheter. Now the lubrication is important because when you put it in, there's going to be friction, and that friction means pain, and you don't want pain. You want to minimize that as much as possible. So I like the self-catheterize, the self-lubricating catheters, and you can see here on the instructions it says just cut off the end, and there's the picture there saying just fill this up with water. So I cut that off, fill that up with water. I use distilled water because you don't want an infection. If you don't have distilled water, I suppose you could boil the water, cool it down, so you would kill off any bacteria that's in that water. But you just fill that up to the top and wait 30 seconds, and then you would take it out. Generally you would wear gloves. If you don't have gloves, wash your hands, because if you haven't, you're going to have bacteria on those hands, and it's going to get onto the catheter, and you're going to be in a world of pain. So get gloves or wash your hands. If you use soap, don't use scented soap, use natural soaps, because it's sensitive down there and you don't want chemicals that are going to inflame things. I use coconut soap, and that seems to be nice and gentle on my skin while killing off the bacteria. So where were we? Yes, yep, you fill it up with water, you pull the catheter out, and you don't touch the shaft of the catheter. So you pull it out, there's the shaft. You don't want to be touching any of that. If you've got gloves, it's fine, but if you don't have gloves, you want to basically avoid touching any of this. So that end there goes into the end of your penis, and you gently put it in. Now what I find with nurses in hospitals is generally they put it in and then they go boop, 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 and it's done, and you're screaming out in agony all the way through. But when you do it yourself, you can take as much time as you need. So generally I find the first few parts, make sure it's well lubricated, go in, and you won't have any pain at all. In my case, the prostrate's quite inflamed and angry, and it's got scars from previous catheters, and it's bleeding and all the rest. So I would have pain when I get to that point. But you can take it at your own pace. So that's the good thing about self-catheterization. So you're just holding the end point, that point there, and you're just slowly sliding it in. When you get to the prostrate, this is for the men, if it's enlarged like mine, I would hit the prostrate and I'd have resistance because it's narrow at that point. And so I would have trouble getting it past there. So you can get catheters with different types of ends. So this is just a normal rounded end, but you can get ones that have got they come up at an angle, and they're said to be better to get through passages like the prostrate. I'm a bit scared about those because I've heard stories, because they're like pointing upwards, that as you're putting it in, if you're too overzealous in pushing it in, that it could break through the wall of the urethra, and then you're not going to have a good day. But I've never experienced that because I suppose that's quite rare, but I've heard nurses talking about it. So yeah, push the catheter in, it's well lubed, and you get it through the prostrate, and then eventually comes out into the bladder. And as soon as that happens, urine's going to come out this end, and it's going to gush out, or it's going to come out at a fair rate. So if you're not prepared, you're going to get urine everywhere. But what I do is I would sit down on the toilet, I would lie back, so because you don't want to really be seated, you want to sort of stretch out so that you've got nothing that's bending. It's like almost a straight line, and it feels more comfortable. And then I'd get a bucket so that it's ready for when the urine comes out, and then I can measure how much urine I passed. So I said, oh, I self-catheterized and it was 750 mil in there. So that's a good thing I catheterize, because you don't want to really go beyond that 750 point. So yep, you're going in, all of a sudden wish it starts coming out, and you'll have the whole feelings of it's coming out. And generally with males, like that much of the catheter will be remaining, about that much, about 8 centimeters will be hanging out. So you push it in, and as you can imagine, the catheter's gone in and the holes are up here, so it's going to drain all the urine that's up to that point. So that's why once you've drained as much as you can, you then slightly pull it out, and it brings this closer to the base of the bladder, and you can pick up whatever's remaining at the other end, and then just confirm that you've got it all. And when you're happy, you can then pull it out, throw that in the bin, and Bob's your uncle. You've self-catheterized. You've now got relief. Right, so that's self-catheterization. What points did I miss? Okay, when you get these catheters, there are different sizes and their numbers. So this one's a French 16, which seems to be the standard. In my case, the prostate was so enlarged that even with a French 16, which is a medium size, the diameter was just, it was fine going in, but once it hit the prostate, I was pushing and pushing, and it was bending, and I just couldn't get it through, and I could spend 10 to 15 minutes trying to push it through. So when I went and saw my surgeon for a permanent catheter, he said, oh, okay, let's have a look. And I said, I'm having trouble getting 16 through. So he gave me a size 14, which is smaller. So this whole passage will be narrower, and you'll pass less urine, but that's what I needed in my case. So what I wanted to explain here is there are sizes. When I first bought my own catheters online, just in case something ever happened, I got the wrong size. I didn't know about sizes, so I got a size 20. And when I had trouble, I tried to put that in, and it went in, I just couldn't get it past the prostrate and I had to go to emergency. So I would recommend for men 16 is the way to go. And I heard that because there's less length in women, it's much shorter. So when you go online, you'll see male and female catheters, and the female catheters will be quite short. And usually 14 is the way to go for women because there's not much to traverse there. All right, so that's self-catheterization. Yes, if you don't get the self-lubricating ones, you're going to need these gel packs, which are these ones here. And you cut off the end, and they're full of a white, clear gel. And you're going to have to get your catheter, which is not lubricated. You're going to have to like put it into the gel pack like that, get it on there without touching it with dirty hands like this. Everything's going to be clean. You're going to have to put it in, get it in, and then somehow get it on as much length as you can. Wet it, of course, beforehand with sterile water. But yeah, lubricate it as much as you can. Maybe you've got to use 3 of these packs and then put it in. But my experience is, and from others that I've heard online, is self-lubricating catheters are much better because they just lubricate the whole thing. And what I do just for good measure, so I don't have discomfort, is even with a self-lubricating one, I would cut one of these packs and then put it in so there's even more lube on the front, so I get the best of both worlds. All right, now more topic. I'll talk more about cleanliness and to avoid UTI. So yeah, we've got gloves, but every day the routine is you get up in the morning and you take off your night bag, which is this one here. So you disconnect that, and well, you empty it first. So you would go to the toilet and you would, oh, that's already open, so you would be closed like that, and you would open it up, drain it out, and once it's drained, you would then disconnect this and put on your day bag and secure your straps. Now this bag, like I've been wearing catheters for 3 months now, you're going to use this again the following night, and what you don't want to have happen is bacteria to start growing inside this bag or the tubes. And I looked online and said, oh, wash them out with soapy water. So that would be exactly what I did. I'd open this up, flush it out with water, soap, what have you, and it would be nice and clean, and then I would hang it in the bathroom to dry, and that worked. But my bathroom, with the sunlight coming in, it gets warm, and bacteria likes warm, wet environments. So I got UTIs and they just weren't going away, and I realized, hey, these bags aren't being sterilized properly, and I soon worked out that I've got to clean the bag, and I would put it in a bucket with a cap full of bleach. So I'd get that bleached water and make sure it goes in the bag. I'd clean it and I'd put it in the other end, and then I would sit it in that water overnight for the next time I'd use it. And then when I'd go to sleep, I'd put my day bag for that same process, so that the bleach will basically kill off the bacteria. Water is not enough. When it comes to showers, well, you take the bag off, you basically got the foley just hanging there. You can have your shower, just don't turn it up like that so that the water goes in, just have it flowing over the top. And what you want to be doing is, with that non-scented soap, is gently clean this area here and then around the penis as well, and try and clean it so it's always going away. what you'll find is that if you wear a catheter long enough, there can be crusty, it's almost like mucus that comes out of the urethra, and it starts forming just at the exit point, and when it dries up it gets very hard. So if you put your fingers across the catheter like this, you'll find some sharp, hard pieces that are forming. It doesn't happen all the time. Maybe over a month I might have it 3 times, and you'll feel them, and you need to clean those off because they're very hard and sharp, and if the foley catheter moves in and out, it's going to do damage. So while you're cleaning it, just look for any hard, sharp pieces and use the soapy water to clean that off. The other thing I do to keep clean is, so this is just coming out of your penis like that, and it's just hanging down like this, and this area here is basically in your underpants, and so it's touching your underpants, and after UTIs you just know that that's not a good thing. Plus it's moving around when you're walking, and it's tugging on the end point, and this end point here can get, the exit point can get quite red raw. And yeah, so I worked out, well, I want to keep it clean and I want to minimize the movement at the end. So what I would do is I would get a tissue or a napkin and fold it in half, or even toilet paper, and I would wrap it around this end point here. So it basically make a cone shape over the top, and then I'd get 2 headbands and put them over the top to hold it in place. So none of that was exposed to my underwear. It was nice and clean, and I would replace that maybe 2 to 3 times a day just to keep this area clean. And it made a difference. It made a difference in that because the toilet paper or the napkin was coming out to this part here, it meant that this end would move around, but less so at this point. So keeping it clean and reducing the amount of movement. That reminds me, there's so many things to convey. This video is getting long, but you probably encountered it at some point. Okay, I remember what I was going to mention, and that was more complications with catheters regarding blockage. So a catheter is designed to be used, or permanent catheter is being designed to use for up to 6 weeks, but generally you'd probably replace it after the 3-week mark. During that time, you should be able to, without pushing hard or pushing at all, the catheter should be draining basically all the time. So you have a coffee or you have plenty of water, and the catheter will just drain it out. I try to drink at least 2 liters of water a day, and plenty of water before I go to sleep, because hey, I've got a catheter in. I don't have to worry about going into retention, which is one of the scares I had when I was my BPH, is that, you know, without a catheter I had to be very careful about how much water I drank, and during the day I would somehow pass enough urine, but at night things got tighter, and so I would try not to drink before going to sleep. But with the catheter you can drink as much as you like, and it's a good thing. The reason why you need to drink a lot of water when you're on a catheter is because if you're drinking a lot of water, it's going to flush out the bladder, and any bacteria in there is not going to have less of a chance to settle on the wall of your bladder and start multiplying. It's going to get flushed out the catheters almost straight away. So that's why you need to drink a lot. So I'd try and drink just 2 liters or more a day. And so when I get up in the morning, I look at my night bag, and it's probably got a liter or more, sometimes even 1.5 liters of water or urine in the bag, which is good, makes me happy. And I look at the color, Usually it's a nice light color. If it's dark, well then, hey, you need to be drinking more water. So getting back to the point, that is that the catheter can get blocked. And so if you've got trauma, for example, the prostrate's all injured and it's bleeding, that can start to block up the catheter. The reason I went to emergency hospital yesterday was because my catheter was blocked, which I didn't know was a thing. I tried to clear it myself, but that didn't work. But the doctor had called me and said, hey, you've still got a UTI and you've got surgery on Thursday. You need to start taking these antibiotics. And I thought, well, that's fine. I'll take these antibiotics. But the antibiotics, depending on the brand, are different. And that was the one that messed me up. So I got violent diarrhea, I got cramps, all the rest. And if you get constipation or diarrhea or anything like that, you're even with a catheter, you can have problems. But so it blocked the catheter with some particle. Who knows what it was? Maybe it could be blood, it could be something, and yeah, you'll need to clear it. So that's why I mentioned previously that if you go to the emergency, what they'll do is they'll fill that up with saline solution or sterile distilled water, and they'll pump it in. In my case, it was 50 ml, and they'll sort of pump it in, trying to clear whatever is blocking the catheter out to see if it starts flowing again. So that's something to look out for. Now, when it does get blocked, one of the symptoms that you'll have is, even though you've got a catheter in, you'll get leakage that bypasses the catheter, and instead of the urine coming out here where it should, it will come out around the catheter, and yeah, you'll be leaking, and because it's blocked. And I've experienced that even though my catheter isn't blocked, if I press too hard, I could get leakage around the catheter. And this reminds me of another issue. When you have urine and it burns, so you got a UTI, or you just got this burning sensation. So in my case, this would burn when I had leakage. There's some things that you can do to address that, and that is because urine is very acidic, so that's why it burns, and it's very sensitive. You can get alkalizing medications like this one here. So this gives me great relief. So if I get burning sensations and I know it's not a UTI, even if I got a UTI, I would drink this. It's not going to fix the UTI, but it's going to take that burning sensation away because it's going to alkalize the urine. So basically you're not peeing acid, you're peeing something with a lower pH, well, more alkaline pH. So that definitely helps. The other thing I do to avoid complications is you want to avoid diarrhea and you want to avoid being constipated. So when I would take antibiotics, because it messes up your digestive tract, basically kills off all your good bioflora, you're probably going to be constipated at the end of it. So I would take some things like this, like natural softeners, to try and make sure that nothing gets too hard, because that affects you. If you didn't have the catheter, you'd probably go into retention if you had a blockage down there. And inversely, diarrhea can do the same. So you're going, and you're pushing hard, and things get inflamed, and a prostrate which is already passing a minimal amount, can get restrictive because it's inflamed, and you go into retention. So it's good to have like a pack of these. I find these ones quite good. They're not harsh at all, and just keep everything soft. And the what was the other? And if you're really in a bind, you have some enemas to. I've never had to use these, but just in case, have them handy. Right. So, yes. So let's talk about treatments for the guys out there. If you've got a large prostrate, in my case it's been 5 years, it starts off with things like drinking alcohol, and after drinking alcohol you just find it harder to pee, or you have to go multiple times to empty your bladder and you're just having difficulties, and then it progresses to where you notice that your flow is not as good, or if you have diarrhea or you're constipated, things are a little bit worse, and then you're finding that you're getting up more often at night and it's harder and harder to empty your bladder, and just after you've gone you've got to go back 10 minutes later to do it again. So they're the sort of symptoms that you have, and eventually you'll see a urologist, you'll probably see a GP that will refer you on. You need to get to the urologist sooner than later. Don't just stop at the GP, because the urologists know all about this and they can get you on the right track. So what will happen is they'll do the tests, they'll do a void trial just to see how much you're retaining, can you empty your bladder. They will also measure the size of your prostrate, and you'll get all those results, and they'll say something like this, that, oh, your prostrate is enlarged, and there is surgery procedures and what have you, but generally they won't put you on, they won't give you surgery straight off. They'll put you on things like this, which is like tamsulosin, there's lots of others, Flomax, what have you, and these medications or alpha blockers will basically help you relax the prostrate so that it's easier to pee. And so you'll take the medication during the day, and if you don't take it you'll find it harder to, and you'll probably be getting up more during the night. Now there's side effects to these. When I saw my specialist, he said, here, take these and we'll see how it goes. I tried to take them. I was looking forward to take them because I didn't want to have surgery. I wanted to avoid surgery because there's complications that come with that. But the side effects in my case were raging headaches. I couldn't sleep at night. The headaches were that bad. My back was on fire. My throat was dry. I really wanted to take them, but I couldn't. Other guys I've spoken to take these medications for years, and it says it helps them and they're fine with it. So everyone's different. You have to do some digging around to really find out about the side effects. You just read the website about the side effects, and it's sort of like, yeah, erectile dysfunction, blah 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 blah. But if you really dig around and look at some of the specialists in this area and that are willing to talk about the side effects, there are some. So it's up to you to dig into those. And the interesting thing I found out was, even when you stop the medications, the side effects can linger for something like 1 to 2 years. So just be mindful of that. I couldn't take them. So what are the natural alternatives? Well, something like this, saw palmetto. Now this I could take, and it was fine. I didn't have any adverse effects, but for it to start working, you've got to take it for weeks on end. The same for this as well. It doesn't work in 2 or 3 days. You've got to take it for quite a while. I had big hopes for this because it's natural that it would help me, but I guess my prostrate was too far gone, and I was in a bad position. It was all inflamed. So taking this maybe would have helped me, but in my case, I took it hoping it would, help me get through the void trials, but no, I was pretty much the same. But it's still worthwhile investigating. The only side effect that it really concerned me about this was the if you take this long enough, your T levels start to drop, your testosterone levels. But when you got going into retention and that, you've got bigger fish to fry. Alright, so that's the medications. What else is there to discuss? I suppose it's surgery. I've got my surgery tomorrow. I've been waiting a long time for this. I wanted to get UroLift 2 for my surgery. When I saw my specialist urologist, unfortunately he no longer did UroLift 2, and he does TURPs or TURP. So I said I'd make that another video, but I'll just give you a summary of it now. UroLift 2 would look fantastic. The idea is that you would insert the scope in, and it fires out little nylon threads through the prostrate, and then there's anchor points that it can set and tuck in the inside of the prostrate to make the narrow part open up and give you better flow. So that was fantastic because they're not cutting away at the prostrate, cutting into nerves and damaging pipes and what have you. They're just sending out these little threads and tucking in the inside. Probably put 4 or 6 of them in, and 30 minutes later you're out, and they haven't damaged the nerves as such. So you're not going to get issues with retrograde ejaculation, which most men have, or like 90% of men have with the TURPs procedure. So the TURPs procedure is, well, they put the endoscope in, and it has a round loop with electricity going through it, and they basically scoop out the inside of your prostate, making it a narrow passage larger. But unfortunately, when they do that, there's a pipe that comes in where the seminal fluid is emptied into your urinary tract. So that comes in the middle of your prostate, and yeah, when they're scooping out everything, they can damage that. So the seminal fluid's not going to come out, and so yeah, you're shooting blanks. You're not going to have children after that. In my case, I'm 60 this year, so that's not an issue. But if you're a younger guy, that would be something you need to consider. So if you're young, I'd go for the UroLift 2. I would have persisted with the UroLift 2 path if my prostate wasn't so large. When I did research online, I found out that the maximum size for the prostate was, well, when they shoot out that nylon thread, it can only traverse 2.5 centimeters. That's the max limit, and my prostate was right on that max limit. So I thought, hey, if I get handed off to another specialist, it's going to be another 6 months later, and he'll find out that I'm not suitable for UroLift 2 because, you know, my prostate's too big, and I'll have to go back to my other specialist who's going to do a TURP anyway. He did say something interesting about the UroLift 2. He said, well, if you get the UroLift 2 and it doesn't work, we can always come back and do a TURP after. And one of the things they'll say about UroLift 2 is, oh, it's new, you know. The general consensus is like, it's only going to last 5 years, and then you're going to have to do something about it. But there are patients who have had UroLift 2 and they've crossed the 10-year mark and they're still good. So I would discount that as a hard fact, that you could get a UroLift 2 and 10 years later you're still fine and not need another procedure or a TURP. I've spoken to other men who've had TURPs, and most of them have said they've been fine, and you know, everything's been good afterwards. There can be complications that require you to have a second procedure, you know, scarring, stuff like that. One guy I spoke to had a TURP when he was very young, in his 40s, because it was running in the family, and that was fine. But 10 years later, when he had his second one, his specialist said, hey, be prepared for complications after the second one. And sure enough, after his second TURP, he had trouble with you know, dysfunction and things like that. Yeah, So I guess if you can't pee, you've got to do something. So my surgery is tomorrow. I'm looking for a good outcome, just to be able to get back to a normal life. Generally what's going to happen with the TURP is you'll spend 2 days in a hospital. Maybe you'll pass blood and bits and pieces for the first few days, and then 3 weeks recovery time. Oh, talking about blood, thanks for watching this far, but since we're talking about blood, it reminded me with catheters. So when you have a catheter, you can pass blood, and it can scare the hell out of you if you see a bag full of urine and blood. And because I had done some research, even though I'd done research, I was still shaken up to see a bag full of blood. The rule of thumb from what I read is if you can't read a newspaper through the blood, well then that's too thick. But generally what happens is you see blood, drink as much water as you can to flush everything out. My worst case scenario was I had an intermittent catheter because my appointment to get a permanent one was days off, and I was just desperate. So I was putting in an intermittent catheter, and things were getting really, they were starting to bleed and what have you. And I was having trouble getting it past the prostrate. So I would leave it in overnight. You shouldn't do that with an intermittent catheter, but I just wouldn't be able to get another one in. So I didn't have any smaller catheters on hand. So yeah, lots of blood was coming out, and I was drinking lots of water, and it would eventually clear up over time. So don't panic if you see lots of blood. There was one point where the catheter actually had a blood clot the whole length of the catheter. So I grabbed the end of it and sort of like pulled it out, and a big long soft clot came out of it. So yeah, they can get blocked up with blood as well. So yeah, it's an experience, not a pleasant one. If there are positive aspects to living with catheters and pain and UTIs, is that I found that I now am more empathetic for people in pain. So if I'm shopping and I see a guy walking funny, and I go, hang on a sec, he's wearing a catheter, or I see someone in pain in hospital, my heart goes out to them now. So I really can empathize with people who are dealing with pain on a daily basis. And just to have relief from pain is, that's the thing that you find more precious than anything. So you can have holidays and nice things, but if you're in pain all the time, just being without pain for a day is bliss. So I'll try to leave on a positive note here, that if you're dealing with these issues, that you can get through them. It can be frightening. I know I'm sensitized now, where if I'm not passing enough urine, I almost go into a panic state. It's not coming out. I'm going into retention again. It can be quite distressful. But with knowledge, you can learn to manage it, and there are good specialists out there who can help you. So I recommend you see a urologist as soon as you can to put you on the right path, because GPs, they're not specializing in this area. So try and get to see them as soon as possible, and it can be dealt with. And don't be frightened of catheters. When you're in retention, these can save your life. So yes, there's pain associated with them, but it's worth it. And if you're self-catheterizing and you're doing everything right, you can do it without pain. There's days where I've had no pain at all, and I've done self-catheterization where I didn't have a UTI and everything was good, and there was virtually no pain because everything was lubricated. So yeah, you you can get through this, and if you have surgery, you can probably get back to your normal life. Because what I found is it's not only you that's suffering, but also your family members as well. When they see you in pain, or they're trying to book holidays and they're not sure, can you make it on the plane without issues? What happens if you go into retention when you're when you're in a hotel? So I've experienced it. I've been in Japan, I had to go to hospital there, London. It's not nice when you're traveling and you go into retention. So the sooner you sort this out, the better, and get back to your normal life. Well, that was a long video. I'll try and follow up with some more on the surgery aspects of enlarged prostate. Since I'm having my operation tomorrow, I'll give you some fresh updates as soon as I can after my surgery to let everyone know. Of course, listen to your doctor. This is not medical advice. This is just my own experience. I've got lots of stories I can tell you in other videos, but definitely confer with your specialist and your GP about what to do. It doesn't hurt to listen to other people's experiences and find out that you're not alone. Well, hopefully that's been of help to everyone, and I'll catch you in the next video. Bye.